We want to get to our interview segment. May is American Stroke Month. Today's guests say it's important to be fast when it comes to spotting those symptoms. We have Dr. Brian Weissman with UT Medical Center here with us today, and Mindy Savage, who is the Director of Development with the American Heart Association. So first of all, let's talk a little bit about stroke. The numbers are wild when it comes to how many people experience them and how often we see them, Mindy.
Yeah, well, you know what surprised me is there is a stroke every 40 seconds. So that means 1 in 4 people are going to have a stroke in their lifetime.
That is a really staggering statistic and something that really makes your eyes go wide. Dr. Weissman, talk a little bit about why that may be. Are those always going to be sort of things that are environmental or things with a lifestyle? What are some of the reasons that people have strokes?
Yeah, so there are several risk factors that increase someone's chance of having a stroke. Age, high blood pressure, diabetes, high cholesterol, smoking cigarettes, exposure to secondhand smoke as well, and an irregular heart rhythm called atrial fibrillation. I always stress, very important to know your risk factors. Check in with your primary care physician regularly. If you have a brain, you could have a stroke. So even young people can have strokes. We do see it more commonly in elderly folks, but even a young person can have a stroke. So know those risk factors, manage those risk factors, get regular exercise, eat a healthy diet. All of those things will help reduce your risk of having a stroke. We think that almost 80% of strokes are preventable, and so that's very important to know those risk factors and manage them aggressively with your doctors.
And I just wanted to throw a little anecdote out there. My dad suffered a stroke in September during a brain surgery. So while you said 80% of those strokes, are the reasons that those happen, but sometimes they're things like during a surgery, and they can happen without you even expecting it and without people being around to notice the symptoms.
That's right. Yeah, there are certainly situations in which increases someone's risk without them really having an opportunity to decrease that risk. And doing complex brain surgery is certainly one of those areas where the blood vessels can be easily manipulated and potentially increase the risk of having a stroke.
And the main thing too, Mindy, is to be fast when it comes to recognizing the signs of the stroke. But that's not just a 2-word phrase. It's an acronym that we can remember.
It is. It talks about balance. How is your balance being effective? Your eyes. Do you see something out of the corner of your eyes? Then B, fast. Your face. Is one side drooping? Your arm, do you have arm weakness? S, your speech, is it slurring? And T, it's time to call 911. We want to emphasize that time, calling 911 as soon as you notice any of those symptoms.
Because with the stroke, time is really of the essence.
It is.
And talk a little bit too about how certain people may have more elevated risk of a stroke when it comes to men or women, and ways that you can prevent that.
Yeah, so we were talking a little bit about the increased risk in women, probably related to hormonal estrogens that circulate in their system that cause their blood to be a bit more hypercoagulable is what we call it, that clots easier. And so again, knowing those risk factors are very important to help mitigate your risk of having a stroke in the first place. I want to emphasize one thing about Be Fast. The T is for time. Calling 911, very important. The EMS calls us ahead of time. Our stroke team at UT Medical is ready in the ER, waiting for that person to arrive to expedite treatment, because like you said, time is brain. The quicker that we can start those treatments, the more effective they're going to be and the better outcome.
Yeah, all great things to remember. And Mindy, really quick before we go, tell people where they can find more resources as it relates to the American Heart Association and stroke.
You can go to stroke.org, where we have a stroke simulator that will walk you through Be Fast and what it looks like in your body. So head to stroke.org for all the information that you might need.
All right. Thank you both so much for joining us today. Mindy Savage with the American Heart Association and Dr. Weissman with UT Medical Center. Know those signs of a stroke. It may save your life or a loved one.